we are pleased to welcome three members of the Strait-Richmond Palliative Care Society. They are Nancy Cameron, who is the secretary on the Society's executive. We're also pleased to welcome two members of the board, Dale Orychock and Judy Morrison. Thank you all for joining me today.
Thank you for having us.
Yes, thank you, Adam.
It's a pleasure to have you, and we'll begin our conversation by asking each of the three of you what got you involved in palliative care. And you've been involved in different levels through the years, not just on this society. Nancy Cameron, I'd like to start with you. What made you want to invest your time and your energy in the society and to this very important role that is played in the healthcare of Nova Scotians and those here in the Strait?
Thank you, Adam. My history goes back to 1992 when my mother was diagnosed and told she had a terminal illness down in the United States outside of Boston. And her one wish was to remain at home. And at that time in Boston, they had a hospice, which was invaluable to our family. And I was living here in Nova Scotia at the time and working as a nurse at Strait-Richmond, and always felt that something came up in our area regarding hospice palliative care. I wanted to be involved. And several years later, there was a ground root from the ground up. Folks decided we needed a palliative care society. And I was invited to be on the board from the start. And so it was my privilege to be on the board. And then I got the opportunity to be the palliative care nurse coordinator at Strait-Richmond. And at that time, I stayed ex officio on the board for 19 years. And when I retired, I felt my passion is palliative care. And if I had something to offer, I'd like to stay on the board. So I did take a little break from it. And now I'm back on it and serving as the secretary at the present time. But I think all of us that are on the board bring very different backgrounds, as you'll hear from the others. And it's a wonderful blending of us working together, which is so vital in palliative care that we be a team.
Well, thank you, Nancy. And I did want to get the other backgrounds as well, too. So I'm going to shift over to you, Dale Orychock from Hay Cove. And you have special reasons for wanting to continue this work as well, too. Can you tell us a little bit about what motivates you to be involved in palliative care?
Well, Adam, I began a palliative care career in 1989 in Sydney, and I worked for over 20 years as a palliative care nurse coordinator and watched the program grow over the years. So when I retired to Richmond County, I still wanted to stay involved. As Nancy said, you feel very passionate about this work. So having known about the Strait-Richmond Palliative Care Society through provincial networks, and I knew some of the volunteers, I was just very happy to become part of this small but mighty organization, and to feel as it's a privilege to be able to stay involved in work that I loved for many, many years.
And we've appreciated your years of service to this as well, too, Dale. So thank you. We shift over to Grand River Falls now, and Judy Morrison, you have a very specific reason for wanting to be involved in the Palliative Care Society as well, too. And as with Nancy and with Dale and with so many others, it's often very personal. Can you tell us your story?
Actually, yes. 1999, my father-in-law, excuse me, became very ill, and that was my first introduction to palliative care. And that's where I actually met Nancy first. And I always wanted to give back, but there just didn't seem to be a right time. And about 8 years ago, my brother passed away in Arizona. And palliative care was involved there for he and his family. So I thought, I can't keep putting this off. Now's the time. So I wanted to give back. So I've joined and met so many wonderful people on the society. And I've, patients as well. So that's where I'm at. I'm a volunteer and a member of the society as well.
some of our viewers here in Telile might recognize you, Judy Morrison, as a former member of the Strait Regional School Board, and before that, a former chair of the Richmond District School Board. So we appreciate that your legacy of public service is continuing, as is the case with so many others that are part of the society. So thank you all for sharing your personal stories. I wanted to ask you now about the current state of palliative care in the Strait-Richmond coverage area. And I mean, obviously, this question can be answered any number of ways. I'd like to begin with you, Nancy, but Dale and Judy, please feel free to offer your thoughts afterwards. I want to get a sense from you on where we are now, not just in terms of services being offered, but whether you feel that Strait-Richmond palliative care as a whole is reaching the mandate that's set out for it. Nancy, your thoughts?
Okay, one of the we're very proud of the palliative care team out of Strait-Richmond, which consists of a physician, a nurse, a occupational therapist, and social worker. In Richmond County, this last year, 2022, the statistic shows that 45% of people that were in their program in Richmond County, 45% died at home. That's a wonderful number. Nationally, it's nowhere near that, even locally within our province. So that speaks to the dedication of the people that are at the front line. And also we feel very proud that we maybe have a little part in that too, in supporting them. That being said, we always want more, as Dale and Judy and I always say. We're pleased with how far we've come, but we want more. And I think there's things going on. Judy can speak to what's going on right now at the Strait-Richmond regarding redecorating of rooms.
Judy, would you like to jump in there?
Yes. We have 2 rooms designated prior to COVID. That was necessary that the hospital use them as well. And now we have these 2 rooms back, and we are repainting them. There's been furnishings ordered. The hospital foundation has been kind, and I've ordered 2 cuddle beds, which were very expensive. We've talked about that for a few years now. So they're on order, and all the furnishings are on order. There's new flooring had been put in about 3 years ago, and that the rooms are being repainted. And now we feel that we're getting somewheres that will bring comfort. There'll be sofa and chairs, TV, mini fridge. So we're hoping to make not only the patient, but the families feel a little more homey.
And to that effect, Judy, can you tell me a little bit more about what a cuddle bed is? I think we all have an idea, but just for our viewers, it's an interesting concept. What exactly is that?
Cuddle bed is very similar to a hospital bed, I believe. I have not seen one yet, but it extends. So if a family member wants to join their loved one it comes out to, I think it's a double size. It's there for family to stay close to their loved one, or if a child wants to, or a grandchild wants to be there, it gives them that extra comfort of family.
And that's just one example of services that palliative care provides, but I think it really drives home the overall theme of compassion when it comes to allowing family and to be able to be with their loved ones at this time near the end of their lives. Dale, your thoughts on where palliative care is now in this region and where it could go? Obviously, you've spent many years in the system. Well, what do you think about where we are at this point?
Well, as Nancy said, it has some wonderful statistics in terms of allowing patients to be at home. And I think, a lot of time the literature has said if we ask most people where they'd like to spend their last days, it is in the comfort of their own home. They say probably about 75% of us would opt to be at home at end of life. And so we would hope to someday get to that number. That's probably always a dream, to be able to allow people to be in the comfort of their home, their own environment with their family. So the society has done so many things in the last while. Unfortunately, COVID has slowed some things down, and we weren't able to do some things. But what has come back is education. And in the last several months, the Society has put on some wonderful workshops for VON staff for long-term care, and sent nurses to conferences. Actually, this month, Nancy, I think we've sent some nurses to the conference in New Brunswick, which they were very thrilled about, and looked at the agenda, and it was certainly worth the journey. But so education is so vital. Palliative care is still relatively new in terms of healthcare. It's well over 50 years here in Canada, but it's still a little bit in its infancy in terms of wanting everybody to have the knowledge around palliative care. And maybe just a word about Palliative Care Week. It's the theme this year is palliative care everywhere, and we think that's just a wonderful theme because it speaks to, it doesn't matter where you are at end of life, that palliative care, the whole philosophy, the concept of whole person care and family care should be part of your last days and weeks and months of life, no matter where you may be. So the education is a big part of what's come back, and the Society has always done that over the years, but with COVID behind us, hopefully we can do more of that.
And just to add to that, I was just going to say, adding to that palliative care everywhere, it's also for everyone. I think historically we often thought it was just for cancer patients, and early on it was. Yes. But now, I'm not sure what the statistics say about locally, but up to 50% of their patients now are people with end-stage lung disease or kidney disease or ALS, those other non-cancer end-of-life illnesses. And on the education piece, another local conference is coming up in a couple of weeks in Antigonish at St. Yves's, the provincial palliative care conference, and some of us will be attending that. So it's kind of nice to have something local to attend.
Yes.
And just to pick up on that point, I mean, there's still in some small corners a misconception that palliative care is basically the last day or two and basically preparing someone to die. And there is preparation for that, but it's much longer and it's much more intricate than that. Do you feel those misconceptions, any of you answer this any way you wish, do you feel some of those misconceptions are lessening now due to the education provided by groups like Strait-Richmond Palliative Care Society?
I think it's improved a lot over the last number of years. Actually, I just looked at a statistic last night that said almost 90% of those who die anywhere could benefit from palliative care. So basically they're saying if you do not die unexpectedly, you may be able to benefit from some component of palliative care. And I guess it's not just an organized program, it's a philosophy. So if you get that education out there to everyone in healthcare, they can respond when somebody is nearing end of life. And, it's whole person care is the big concept around palliative care. Belford Mount, who was probably the founder and father of palliative care in Canada, says someday palliative care will bring all of healthcare kicking and screaming to recognize whole person care. So it's not just the illness or the disease; it's all of the psychosocial, emotional needs in the family together.
Very much so. Now, I wanted to ask all of you about what you feel the current level of participation and recognition from the provincial and federal governments is at this time with regards to palliative care. I'll start with you, Nancy. Judy and Dale, jump in if you wish. But where do you feel in terms of even just basically working with the society locally, that level of attention from the provincial and federal governments are right now?
Yeah, I think first we want to mention local municipal. Richmond County is extremely supportive of us, generously donating annually. So we really appreciate that. And those monies will be going toward the rooms that we're redecorating. So we it's invaluable to us for sure. Provincially, there is a Provincial Palliative Care Association, which will be sponsoring that conference that we're going to. I think through the years, they have a provincial palliative care network, and they recognize, it seems more and more, the value of us folks in rural areas. It's just not a Sydney and Halifax type of thing. So that's been very helpful. They started quite a few, well, probably within the last 10 years, a program through the EHS program. Like, it's our dream. It would be lovely to have nursing care 24/7 at home. That being said, it's not happening, but there is a program through EHS where patients are, they're enrolled in a special patient program, it's called. So if a palliative patient in the middle of the night gets into a crisis, the family can call 911 and their number will come up and it'll be recognized, and they can see what the patient's history is. So that's come a long way. That's a really good thing. What else, ladies? I don't know what else.
Well, I think there's even a push for nursing and medical schools to include palliative care knowledge and education for everybody. You know, it's not just a specialty that somebody chooses to work in that field. It's something everyone who's caring for people in the healthcare field should have some basic knowledge. And I think, you know, the schools and programs in the province have done a good job of moving that forward too.
Right. Judy, any thoughts?
Yeah.
I think that it's finally becoming better known, even for our small area. And we are now getting more help from the provincial government. And as Nancy said, the municipality is always very good to us. It's just, like I say, where we're small, sometimes we wonder if we're being forgotten. But it seems now that things are starting to move forward.
All right, glad to hear that from all three of you. So as we're wrapping up our conversation today, we are in the home stretch. Where do we go from here? Is there a wish list of any sort, even looking 5 to 10 years down the road, or perhaps even 1 or 2 years down the road, that the Strait-Richmond Palliative Care Society would like to see in terms of the delivery of the service locally? And I'll start with you, Nancy, but we'll get thoughts from Dale and Judy as well. So basically, where do we go from here?
So one, as we were speaking about this before, the poor cousin in palliative care is bereavement care. And I think we'd like to see that improved for sure, like more access for folks who have complicated grief, to have access to like a support group or the professionals that can help them through their grieving. I mean, we all know grief is normal, but sometimes it gets a little complicated for sure. And that being said, we do have a time of remembrance, which is coming up on the end of May, remembering those that have died in association with the program, from February 1st, 2022 to February 28th, 2023. And that is a new thing that we're starting since COVID. We had it before COVID. The last one was November 2019. So that's one small thing that we do, and invite the families of those that are bereaved. And it's always a very special evening of music and memories and poetry and a speaker usually. So that's something that we're glad we can do, but we'd like to be able to do more, but just the resources aren't there.
Judy, your thoughts, where we go from here in terms of palliative care locally?
Well, I think one of the things that we have to look at are volunteers. We are an aging society right now, and it would be great if we could get younger people interested. And I'm not sure, excuse me, exactly how we could do that. I think one of the things that maybe frightens people off is when they hear palliative care, they're just thinking end of life, which it is. But at the same time, you could have a patient for 4 years, perhaps, that are, palliative, but are well enough to still go maybe into the hospital for something. And they may decide that they want to have somebody to talk to. Maybe they don't have any family.
Yeah.
So, if people can look at that aspect of it, that would be wonderful for us.
Dale, your thoughts on the future of palliative care, or even immediate future in this area?
Yes, and I agree with Judy. You know, the need for more volunteers. Unfortunately, again, you know, COVID, we've lost a lot. There's some new programs even being thought about. A flower program, for example, that volunteers would do small arrangements and bring them to the patients on a regular basis, or you know, music program. There's so much opportunity, you know. So I guess we're probably recruiting for some more volunteers to be
Yes.
involved, and you know, and into the home especially. Sometimes, you know, just to shovel the walk or mow the lawn, you know, means so much to sometimes elderly couples who just don't have that support. You know, volunteers can be invaluable.
And for our viewers watching this panel discussion on YouTube, we actually are able to promote a special fundraiser that the Strait-Richmond Palliative Care Society is doing this Friday, May the 5th. Can you folks tell us what's going on?
We have some pamphlets. There's, I believe, 4 locations within Richmond. We ourselves on this end will be at the Farmers Pantry, and we have pamphlets to give out on grief. And we've also been lucky enough to get into chocolate in the shape of a sunflower. And it's the lady,
Cindy.
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 And she's been very kind to have made those. So we have those for sale for $5 if anybody is interested. And if anybody has any questions, I mean, we're there certainly to answer them. And I know that there are like 3 other locations.
Orychock, the Mini Mart and Charles Forest Co-op. Louisdale is the Louisdale Co-op. Port Hawkesbury Atlantic Superstore and Shoppers Drug Mart. And St. Peter's is the Farmers Pantry. So those will have tables, brochures, some chocolates for sale.
Yes.
And, you know, we're so pleased that Cindy has contributed to this over the years. And she actually sells them all the time at her chocolatier in St. Peter's. So this has been, again, you know, wonderful community involvement to support, you know, palliative care.
Well, we're glad to be able to let our YouTube viewers know about that. We'll do what we can to let the rest of our Telile viewers know as well. And in the meantime, we are in the home stretch of our conversation. We've covered a lot of ground, as I thought we might. Do any of the 3 of you have anything else you'd like to say just before we wrap up here?
I invite people to look at our Facebook page, which we update fairly often, and also we have a website that's active.
Dale or Judy, any final words?
Quote that, you know, it takes a village to raise a child. I think it takes a community to help us die well. It's not just about healthcare delivery. It's about the community in which we were born and we lived, and we will die with family and friends around, and support from everybody.
Judy, last words to you, if you'd like.
I find that the palliative care as a volunteer has certainly changed things in my life. I think it shows so much compassion and care and love. And even when you meet the patient, you get this extra, bad word maybe, but extra life from them. And it's so nice to be able to sit down and just chat with them about whatever they want to chat about.
We know that service in palliative care at any level often involves a very personal stake, and we are grateful to all 3 of you for sharing that personal stake with us this morning. And we thank you for what's really a very noble service for many people in our community and for their families. So thank you all, and thank you for joining me for this panel here for Telile Community Television today to mark Palliative Care Week. Thank you so much for joining me.
Thank you.
Thank you, Adam.
Having us. Really appreciate it.
Thank you. Yeah.
No trouble at all. Nancy Cameron is the secretary of the Strait-Richmond Palliative Care Society. She is from Pleasant Hill in the Port Hastings area. Dale Orychock, a longtime palliative care nurse in the Cape Breton Regional Municipality. She is based in Hay Cove and serves on the board of directors for the Strait-Richmond Palliative Care Society. And Judy Morrison is a former director of the Richmond District School Board and a former member of the Strait Regional School Board, a board member of the Strait-Richmond Palliative Care Society. We've reached her at her home in Grand River Falls.